Good afternoon, and welcome to the joint COVID task force for the City of Memphis and Shelby County task force briefing today. I'm David Sweat, the Deputy Director of Shelby County Health Department. I'm joined today by Dr. Bruce Randolph, our local health officer, and we will be available to answer questions for you in a few minutes. A few items I want to cover to begin with, just to cover the numbers and statistics on where we are today. We've had 71,728 COVID-19 cases diagnosed in Shelby County residents, representing 613 new cases today from yesterday. We have 984 deaths that have been reported to the Shelby County Health Department, and that includes an increase of 31 new death reports in the last 24 hours. So we are approaching a milestone moment in the epidemic here in our community. It is possible that today or tomorrow we will go above 1,000 deaths from COVID-19 disease since March 7th of 2020. So far we've tested 852,458 times, and we have an overall positivity rate on those tests of almost 10%, about 9.8%. For the state of Tennessee, we have 625,237 cases that have been diagnosed and reported as of 2 p.m. yesterday. Other jurisdictions in our area that may be of interest: Tipton County has reported 5,729 cases. DeSoto County in Mississippi have reported 15,363 cases. In the Mid-South area, that would be the second highest county to Shelby County in terms of the number of cases. Crittenden County, Arkansas, has had 4,242 cases reported so far as of 10 a.m. today. We also had, at 5 p.m. last night, 661 individuals hospitalized in our community. That is the highest number of people in the hospital to date. So we are very much in the middle of the worst part of this epidemic in our community and experiencing the surge of cases after the holiday break and the opportunities that people had to travel or to gather together and become infected through those gatherings. So those things are having an impact on us right now. But we continue to work with the healthcare system and the hospital systems continue to work to ensure that if somebody does need a bed, that there is a hospital bed available, and that we would say that anybody who is experiencing COVID-19 disease, severe symptoms, and might need hospital care, that they still need to go to the hospital and that their system is doing everything they can to ensure that all people will be taken care of that they possibly can. As far as the vaccination efforts, I know that that is uppermost on people's minds right now. We continue to operate this week with our strike teams going into group homes and nursing homes and vaccinating individuals, but we are very aware that there's a great deal of interest in the community broadly for people to understand when will vaccine be available for them and how can they know what to do to schedule appointments. We are not taking appointments at this time. We are working with the Tennessee Department of Health trying to determine when our next shipment of vaccine will arrive and how many doses will be sent to us. Hopefully we'll get some information about that from the state either today or tomorrow. But in the interim, something I wanted to call your attention to on our website at Shelby.community website is there is a tool that the state has provided, and if we can scroll down to the tool, if you go to that website, Shelby.community, there's a Tennessee online eligibility tool link, and people who want to figure out where do they fit under the current phase plan from the Tennessee Department of Health on when vaccine could be administered for them, they can answer questions that are posed to them in that tool. It's an interactive tool, and by answering questions, it will slot you into the phase and give you information about that. But also, crucially, at the end of the tool, it gives you the opportunity to sign up for email and text alerts for when your phase is eligible to receive vaccine in our community. This vaccination campaign will be a year-long campaign. We are only at the beginning of it, but together with our partners and together with the federal government and state government, we are committed to ensuring that we will vaccinate as many people in Shelby County as we can get vaccine for, and up to and hopefully exceeding the goal of that we need for our community to achieve the levels of vaccination necessary. But it's going to take us several months, maybe even an entire year, to get the entire population vaccinated that wants to be vaccinated. But we are working on that campaign with partners, and for more comments on that and also the health directives, I'm going to invite Dr. Randolph to the podium.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for the Shelby County Health Department. Just want to mention a couple of things, and we'll open up for questions. As you well know, that the Safer at Home health order and health directive number 16 ends in 15 days, January 22nd. So we're looking at the data and monitoring it to determine what next steps we will take. But I do want to take this time to emphasize that personal responsibility and individual practices will be a key component of whatever we do now. As I had mentioned before, we've done most of what we can do until everyone gets vaccinated who wants to be vaccinated. We as individual persons must adhere to the safety measures that we have in place: the wearing of the mask, separating 6 feet, avoiding the crowds and gathering. Now, one area that I do want to focus on and direct the employers to is the aspect of the health directive that one encourages employers to allow their employees to work at home, to work at alternative work sites or stations if at all possible. Also, the importance to require that your employees, if they are sick in any way, that they should stay home. When we analyze data in terms of where are people going when they are infected, they may be infected and hadn't gotten their results or may not even know that they're infected. One of the major places where they report that they had gone is work. And we actually have identified some cases, many cases, that are associated with work and the workplace. Therefore, we're asking that the employers really encourage their employees to stay at home if they're sick. The other thing is that I've received several emails from employees who are concerned about the safety of the workplace, and that employers are requiring employees to come to work, especially if they are contacts and have been tested and the test is negative. I want to reiterate to you that if you are a contact, if you've been around someone who's have been diagnosed with COVID-19, you've been around that person within 6 feet for a cumulative 15 minutes, you are a contact. You are to be in quarantine. Per the CDC guidance and our regulations, quarantine is actually 14 days. But you can be released in 10 days if within those 10 days you have recovered, you do not have any other symptoms of fever, you can be released from quarantine after 10 days without being tested. You can be released after 7 days if you are without symptoms, without fever, and you are tested and you test negative after being in quarantine for 5 days and you remain in quarantine for 7. You have to be in quarantine for a total of 7 days before you are released. And I want to reemphasize that because I think some employers think that all they have to do is tell an employee who has been exposed or contact, go get tested, and if you're negative, show up to work. No, that isn't how that works. So I just want to reemphasize this. And of course, no employer or employee should be working if they have tested positive for COVID-19 until they have completed their isolation period. And we'll also emphasize them in the health directive the importance that if you test positive, go home, remain in isolation until you have completed your 10-day isolation period. Your primary care provider has the authority to place you in isolation. So we encourage you to adhere to these safety measures. With that, I will stop. Again, I would encourage everybody, we only got 15 more days to go with this stay-at-home health order. Let's really hang in there and see if we can have an impact.
Brad Broders, Local 24.
Good afternoon. First of all, Dr. Randolph, just following up with what you were just talking about, what is potentially, for those wondering, what's potentially on the table of potential additional restrictions or an extension of time once the current directive expires January 22nd?
Well, we're, of course, there's always the option of extending it. But we're also looking at options of really enhancing enforcement, targeting enforcement to areas that are associated with the spread, and really emphasizing people getting vaccinated and placing even a greater emphasis on the messaging of individual and personal responsibility.
Thanks. And as a follow-up to David, I know we heard the numbers, but you do the math, and right now, at the pace that we're on, it would take more than a year to get everyone those 650,000, those 2 doses. What's your message to the public about the potential reality, the long haul, and I guess sort of on that vein, other vaccines hopefully coming online to help expedite that timeline?
Sure. So thank you for the question. This is a matter that we've been talking about with the state for several weeks, but certainly over the last 2 weeks, we've been talking about the vaccine supply, the urgency and importance of increasing the supply of vaccine into our community. Of course, that's not entirely up to the Tennessee Department of Health either, but we are aware of that many other manufacturers, vaccine manufacturers, are working on their versions of vaccines and trying to get those FDA approved so they can be used. And as more vaccine comes into the marketplace, or at least becomes available to the federal government to purchase and send to the states, we anticipate that the flow of vaccine will only increase over time. And then inside the state, participating in a lot of conversations, some communities seem to have reached saturation points. Other communities have, similar to ours, have more demand than we have vaccine available. So the state is looking to see how they can reallocate doses and move those around to increase the supply. But it's going to be a collaborative effort. It's going to take time. It's going to require more vaccine to come into the marketplace, but it's also going to require at some point in this effort that the commercial pharmacies and private doctors' offices would also be allowed to help us with the immunization effort. We're not there yet, but those are all things that are being discussed with the Tennessee Department of Health, and I'm sure between the Tennessee Department of Health and federal Health and Human Services folks.
Jacob Steimer, Memphis Business Journal.
Yeah, thank you. Dr. Randolph, first question is, you were just talking about extra enforcement. Looking through the places that you all have enforced or have inspected on the website, I noticed that very few are warehouses, despite you all talking about how the largest portion of workplace spread is from kind of the warehouse industrial type workplace. I'm curious, why that is and why you guys aren't doing more regular inspections of that type of workplace.
Yeah. Actually, I've recently directed the COVID investigation team to start focusing on the workplace and on warehouses and other establishments where we know that there have been cases. And so that will be an area of our focus, is that we are looking at other places other than your restaurants and placing greater emphasis on enforcement in those areas.
Thank you. And yeah, this is for David. Shelby County recently crossed 70,000 cases. We're nearing 1,000 deaths. I'm curious for an update on, or I don't even know if this is a number you keep, but if you could give us a rough estimate of how those numbers compare to the numbers of people we can expect to have actually had it or actually died from it, if that makes sense.
Right. So one of the analysis, we've got a graduate student from the University of Memphis School of Public Health, and she's helped us with some of that data that was shared earlier this week about the cause of death. Some of the things that I've asked her to spend some time doing analysis for us right now are two areas. One is excess deaths, and she is working on the data files to look at all-cause mortality and the number of excess deaths following a similar protocol to what CDC uses for analyzing that at the national level. So hopefully in coming weeks we'll have that information to share. The other thing that I've asked her to do some calculations about are years of potential life loss. And so that's a way of putting into context what the impact of the deaths are. So she's researching that and doing some calculations on that for us at this time. Hopefully I'll have those soon to share. But we are, as far as how things compare, what we're trying to do with some of our local data analysis is mirror analysis that's been published by the Centers for Disease Control and see how our numbers stack up. Some things that we do track and look at on a comparison basis are our case rates per 100,000 relative to the other counties in the state or other parts of the country. And as epidemiologists, we're really interested in case rates per 100,000 because that lets you compare two areas with very different sizes of population. It's always going to be true that areas with more people will have more cases by count just because the population difference is great. But when we actually look at a case rate per 100,000, we see that Shelby County is in the bottom tier, usually in the last, the bottom five, if not the last two or three, as far as case rates per 100,000 for the state of Tennessee, and that we do believe that that reflects the impact of things like the mask ordinance and other measures that have been taken at a policy level here in Shelby County to try to mitigate the spread. It shows that on a relative scale, we are doing more than many communities to slow the spread, but because of the size of our population, we're the most populous county in Tennessee, we are obviously going to continue to have very high numbers. And in terms of vaccination, I know there's a lot of frustration across America with the pace of the vaccine deployments. When we look at states and how efficiently states are getting their vaccine into their people, we see that Tennessee actually ranks in the top 3 in the nation for distribution and administration of vaccine. It's not much consolation because I understand it feels like it's too slow, but compared to the rest of the country, we're actually apparently doing better than 47 other states.
Kelly Roberts, WMC.
Good afternoon. First, I just wanted to clarify. I know yesterday Dr. Haushalter sent out a statement saying that the last vaccines were currently being used in the county. So today, did vaccinations continue inside those long-term care facilities or congregate settings? Do you still have the last few vaccines ready for use, or have they stopped? Are the vaccinations done with at this point?
No, the nurses are continuing to go into congregate settings and do vaccinations right now. That's the focus of activity this week. And as I said, we are hopeful that either today or tomorrow, Tennessee Department of Health will give us more information about when to expect our next supply, and we'll be able to announce where the next distribution points will be, and people will be able to get appointments, but we're not there yet. We're looking for that information later today or tomorrow so that we can move to the next phase.
So do you anticipate the vaccines to last you at least through the week, or at least until you get the news, whether it be today or tomorrow, about the next allotment? And then also just wondering if you could clarify the 31 deaths reported today. I know that it was in between the 11th of December and the 5th of this month. Does that mean, is it likely that more than 31 people died during that period? It's just what got reported when?
So what we see with our reports of death is they do tend to come in pulses as the medical examiner certifies deaths or vital records is processed. And so we may find out about, for instance, yesterday, 31 deaths. That doesn't mean 31 people died yesterday. It means 31 new reports of death arrived. And maybe that they're processing backlogs related to the holiday break or whatever. I can't speak to why that occurs, but what we know is that those 31 deaths likely are distributed backwards over several weeks, but we just happened to get the final certification and report of death yesterday.
Sam Hardiman, Commercial Appeal.
My first question is for Dr. Sweat. Has the health department had to throw any doses of the vaccine away?
No, absolutely not. We have not had to dispose of any. They were either used on site, or if there were vials remaining at the end of the day, they went back to the pharmacy for redeployment the next day. No, we have not wasted or lost any vaccine doses in Shelby County at the health department, no.
Okay, and my follow-up is for Dr. Randolph. Dr. Randolph used the phrase, it's only 15 more days. The numbers since the Safer at Home order have not really changed in terms of cases per day, and hospitalizations continue to rise. What impact do you think the Safer at Home order has had on the spread in Shelby County?
I think the jury is still out on that, because it would really take about 14 days plus to really see an effect. And that's why we're looking at the remaining 14, 15 days to assess whether or not the Safer at Home was successful and to what extent, and that will guide us in whether or not we need to do what we need to do next.
Jane Roberts, Daily Memphian.
Dr. Randolph, what else could you do besides stepping up security? And I mean, those things seem like they haven't been all that productive in the months of the pandemic. What is still left to do?
I mean, what is left to do is that people themselves must become more responsible and compliant. I mean, short of completely closing everything down, and I'm not of the opinion that that's a viable option. Certainly, it's not a decision that that we would make. It would have to be something that policymakers and public officials would have to make that type of decision. I think we have done as much as we can do. I think that, our role as public health officials is, one, identify what are the risk factors of a particular outbreak and disease, characterize the risk, educate and inform people of things that they can do to help protect themselves from getting infected, infecting others. We implement measures to try to control the spread of a particular disease, infection. And, when we went to the initial stay-at-home, closed everything down, that was early in this pandemic before we really had a full grasp of what was going on, what are all of the risk factors, how they're transmitted. So you try to control and contain things as quickly as you can. As the pandemic has progressed, cases have increased, transmission has increased. We have now a better understanding of risk factors and things that individuals can do. Then the need to completely shut things down becomes less necessary, and more so enforcement of compliance and educating and encouraging people to adhere to the safety measures that has been put forth. We know wearing a mask is effective. Now, individuals must take on the responsibility of wearing the mask. I mean, we certainly wouldn't throw everybody in jail who didn't have on a mask. People got to take it upon themselves a sense of community and citizen responsibility to protect themselves and others. We know that not gathering in crowded places will help prevent the transmission. But people themselves have to take on the responsibility of not going to places. I've said over and over, just because something is open, just because something is legally permitted, does not mean that it is medically advisable. And people themselves, just because something is open, shouldn't go. Yes, we are allowing in on-site indoor dining, but we have stated that we discourage it. We feel that that is not necessarily a safe thing to do, but if you choose to do so, here are some safety measures that you ought to adhere to. Wear your mask. Keep it on until time to eat. Restaurant operators should separate their tables as 6 feet apart. So there are, we are doing things to educate, try to reinforce, but the bottom line is that people themselves must do the right thing. We shouldn't have to just completely shut everything down in order to get you to do the right thing. Is there a follow-up?
Can you talk to me about contact tracing and how long it's taking now to reach the positive cases?
I'm going to let Mr. Sweat talk to that since that's his department.
Yeah, hi, thank you, Jane, for the question. So a couple of things about, and also I just want to also piggyback on a couple of things from the previous question, Dr. Randolph. The actual, I know that we're running over, I'm going to try to wrap this up quickly, but the reason I brought up that our case rate per 100,000 is in the lowest in the state here is that actually is the evidence that the measures that we're recommending are effective. Because if we didn't, given our population, if we didn't have those measures in place, our rates would be sky high. And we actually have some of the lowest rates per 100,000 in the state. But as far as the contact tracing, we are, at this point, I think it would be most accurate to say that we are interviewing samples of the cases. We're getting so many people reported every day that it's not possible to reach them all. We do continue to try to interview as many people as we can during this phase because it teaches us things about what's going on with transmission. So in the past 30 days, we interviewed 1,950, almost 2,000 people. And from that, that's where we get the data about whether people are going out to work when they're infectious, what kind of healthcare or what kind of worksite settings they have, whether they're students or whether they're employed, what the age distribution is. All of that information comes from those interviews. So we are interviewing those folks as many as we can to learn as much as possible about the current pulse of the epidemic. But we are very challenged by the numbers. We're obviously not reaching everybody. But we're also looking at technology solutions. So we have a work group meeting right now with IT services, with the phone company, with the laboratories, and the intent is to start sending out text alerts where people can self-report their data and also receive their isolation instructions via text as opposed to having to talk to us. So we're continuing to explore various ways to reach out to individuals with information and improve our communication strategies. It's an ongoing process, but thank you for asking the question. As far as everything else, I know we're over time. I'm going to wrap up, but thank you and come back again next Tuesday for the next Joint Task Force press briefing. And in the meantime, wear your mask, separate from others, work from home if you can, avoid crowded settings, and stay safe. If you feel that you have been exposed, please go get tested. There's plenty of testing availability, but if you do have signs and symptoms or if you get tested, stay home, isolate for 10 days, and protect everyone around us by doing so. Thank you.
Thanks, everyone.